Dementia strikes people in every region in this country, but the incidence of it, how people of varied cultural backgrounds view it and deal with it, can be very different. Joining us now to explore the dimensions of this among Indigenous peoples, here's Kristen Jacklin. She is professor of medical anthropology at the Northern Ontario School of Medicine. She's based in Sudbury. And Karen Pitawanakwat. She is complex home care coordinator for the Wikwemikong Health Centre on Manitoulin Island, which, as we all know, is the most glorious place in the whole world. Would you agree?
Yes.
I would too. Lovely to have both of you here. Thanks so much. Karen, to you first. Why do we need to look at dementia differently when considering Indigenous communities compared to the rest of the population?
I think a lot of it has to do with our health, the health state that we have in the Indigenous population.
Meaning what?
There's a lot more chronic disease and at younger ages. So the way healthcare is set up, dementia care is for older people, and a lot of our younger people don't qualify for services, for example.
So, Kristen, the problems in health that you might see in older populations elsewhere, you see in younger populations in Indigenous communities, and therefore requires a different approach. Am I getting that right?
Yes, I think so. So the chronic diseases that we see in mainstream Canada, diabetes, for example, heart disease, these are coming on at much younger ages in Indigenous communities. We've learned, and we can see that a lot of those types of illnesses are risk factors for dementia, and so that we see dementia actually coming at earlier ages as well.
Would this be the case for Indigenous people who live both on and off reserve?
We don't have a lot of statistics on dementia in Indigenous populations. The evidence that we do have suggests that this wouldn't be different on and off reserve.
Kristen, do you know whether there would be a genetic predisposition towards dementia in Aboriginal or Indigenous communities?
I wouldn't go that far at all. I think that the issues that have affected Indigenous people, the social issues, the economic and political issues that create the conditions for earlier onset of a lot of illnesses are the same, whether people are on and off reserve. And we see that people move on and off reserve throughout their lifetime for various reasons, right? They'll move to urban centers for education and for work. And often, as Karen has told me, they move back later in life when they are requiring more care and more complex care and want to be close to their family. So it's a very fluid boundary. So it's you can't really think of it as two separate populations with different sets of risk factors.
I see. Okay. Karen, I want to ask about the gender issue, because in the general population, dementia shows up more in women than in men. But apparently in Indigenous populations, it's the other way around, more in men than in women. Any theories on that?
No, so this is, again, we have such little evidence right now. There are efforts going on to increase our knowledge and access to health databases and these sorts of things so that we can look at this more fully. So the studies that we do have indicate that that's definitely the trend. There's the only hypothesis that my colleagues and I have come up with is it might have to do with healthcare seeking behavior, where the wives or the women are more likely to be taking their husbands to be diagnosed. So it could be that the female population is underdiagnosed rather than actually having less dementia.
Gotcha. In your experience, when you practice, do you find it's more men than women?
No, I would say equal where I am, yeah.
I've also been told that the rates at which Indigenous people deal with dementia happens at a greater rate than the rest of the country as well. Is that also true? Yes,
this is what the evidence is showing us, that the number of people, well, the percentage of people in the population with dementia, it was kind of a sharp increase in the last 10 years in the Indigenous population. So there wasn't as much dementia prior to that. And for some reason at that time, around 2007, the rates started to increase, and they were increasing faster than in the general population and surpassed the rates of the general population by 2011.
Karen, is this concerning to you?
Yes.
Do you think you can do anything about it?
I think with the work we've done, both Kristen and I together, we've brought awareness to the community, and people are more open talking about it and learning about it, remembering cases we've had in the past and how care was provided and how we want to keep those values in our community.
What values are you talking about?
Just love and caring and patience, tolerance, yeah.
In Indigenous communities, is there a stigma associated with having dementia?
No, I would say no.
Because there is certainly in the rest of the community, right? In much of Canada, there's still a lot of stigma around this. You don't find it to be the case in the Indigenous world?
We view aged living or end-of-life living, towards the end of your life, as a part of the circle of life. So whatever conditions that elderly person has are not, it doesn't become them. They're still who they are essentially. That this is just something that they carry, something that shows up every now and again, but it doesn't define who they are.
That's interesting because we often have a hard time distinguishing between the disease and the person. But you say there is an awareness in Indigenous circles of that distinction. Have I got that right?
Say that again?
People know it's not, you know, sometimes people with dementia, you know, do strange things, say strange things. Indigenous people understand that's the disease talking as opposed to the person?
Yes,
Yeah.
yes.
Kristen, on the discussion we had just before this one, we learned that there is a strong link between smoking tobacco and developing dementia. And the percentage of Indigenous people who smoke is apparently twice as high as the rest of the general population. So do you think there's an acknowledgement in Indigenous circles that that is increasing your chances of contracting dementia?
I mean, I think that there is an acknowledgement of it. I think and that's not specific to dementia. It's for all cardiovascular diseases, which all have higher rates in First Nations and Indigenous communities. So it's definitely something that communities are trying to tackle broadly, I would say, not necessarily related just strictly to dementia, but it is sort of a community health priority.
How much progress do you think you can make in trying to make that link between smoking and cardiovascular disease, between smoking and dementia in Indigenous communities?
How much progress?
Yeah.
I think it's doable.
Have you convinced anybody to quit smoking?
I think there's pockets of quitters when something has hit the community hard. For example, a cancer diagnosis, there's certain pockets of quitters that just have made that decision.
Now, you're on the eastern end of Manitoulin Island, right?
Yes.
Do you think there's enough awareness there that even though tobacco may be a part of the Indigenous culture and has been for thousands of years, there are serious consequences associated with it, and probably a good idea if you quit?
Yes.
That is out there. That message is getting through.
Yes.
What do you think? Have you seen it?
I think there's challenges in the communities with anything like this, any of the risk factors that go along with chronic disease and dementia. And it does go back to you know, the social, economic, and political issues that communities have been dealing with in individual families. So there's a lot of you know, there's a lot of positive things happening in the community. There's a lot of healthy families, and there's people in the community are still trying to heal as families from some of the policies that have been in the communities from the government over the years. So I think we have to go at this very carefully. We have to have very cautioned approaches and discussions around these kinds of risk factors and dementia, so that, you know, that we are careful to understand that these what we would label healthcare behaviors in mainstream society, that they don't become targets to start blaming people for their illnesses. So I think it's a difficult discussion and a fine line, and it's definitely something the health centers, messaging that the health centers are trying to get out there the best they can, respecting that people are engaging in these because they're not quite healthy yet.
I want to pick up on the government policy that you just talked about there because, and again, I want to tap into your experience here. Obviously, many Indigenous people in this country went through the residential school system. They have the horror of that background that they have to deal with. One of the things that happens to you, I'm told, when you get dementia is that you tend to relive events in your past. And I want to know, for example, when you have a patient who may be in the midst of a delusional episode and is reliving a moment from their residential school past, how do you deal with that?
Just try and divert the topic, what they're talking about.
Does that work?
Sometimes, but there's not very much you have, right? You have to know the person as well. You have to know the kinds of things that they really enjoy, and just bring those to the forefront. Yeah.
Have you seen that happen, where somebody's in the midst of one of those kinds of delusions?
I've seen repetitive storytelling where they repeat trauma that has happened. Yeah.
Is it frightening to see that? Frightening may be the wrong word. You're a nurse. You're used to seeing scary stuff all the time.
Yeah, it's more
saddening?
Yeah, really sad.
Yeah. What happens when an Indigenous person, because they are in the throes of dementia and can no longer take care of themselves, and they can't live at home independently, what do they do?
What do?
Yeah.
They usually have someone, a neighbor, lifelong family members, extended family that are quite involved in their care and in how they're living their life. So we usually are able to assess these situations because we're smaller communities. We're able to figure out who these families are and bring supports to them, education, awareness, how to deal with it, get the person to a doctor for assessments. And it doesn't happen right away, but we're small enough communities that we know each other, and we're available to help.
I hear you, but Kristen, knowing the importance of land to Indigenous people, what happens when you cannot live on your own home anymore independently and you have to leave the reserve? You have to leave the land in order to move somewhere so that you can be cared for.
I think this is really an injustice that happens, and it's extremely sad. So I have to say, there's some communities like Karen's community where there are nursing homes in the community, and so that's not as significant a move, although it's still a difficult move. But when we worked with communities up on the James Bay coast, and there are no residential care facilities there, and there might be 2 or 3 hospital beds designated for a long-term care, and people have to leave, and it's devastating. People that we've talked to in our research about this talk about stories where the loved one has gone down to Timmins to be placed in a long-term care home and deteriorates very, very quickly out of that environment. And so when I say it's an injustice, I mean it's not equitable health care that people are put in that position. And it doesn't just affect, it affects the person with dementia, it affects the caregiver and the family, but it also affects the community when we're taking elders out of the community. And it's reminding people of the 60s scoop when the children were taken out of the communities. And it undermines those cultural relationships between the generations. So, I think this is a place where we can do a lot better as a society and a lot better in healthcare to try and find ways to keep people in the communities. And like Karen is saying, there's amazing family and community supports that I have seen in these communities. I can say that healthcare workers that I've interviewed about this on reserve say that the people stay in their homes longer, that much longer than they do in communities that aren't Indigenous communities. So I think there's some good lessons to be learned from what's going on in the communities with the community support for the rest of us.
Karen, do you have a home care center for seniors with dementia on Manitoulin Island?
Well, we have a long-term care home, yeah.
So if there are Indigenous people on the island, that's a place where they can go? Well, that's very fortunate, because I guess some places further north, you don't have that, and you're talking about going a long way. You just said something I've never heard on this program before, which is going down to Timmins. You don't hear that very often when you have conversations. It's usually up to Timmins, not down to Timmins. Is it problematic to put residential school survivors into an institutionalized setting such as home care?
We've certainly been told this, and people have shared stories with us about going into those settings and that itself being a trigger for some of those traumatic memories to resurface. So yeah, absolutely. The way that they're structured now, or structured traditionally, is very reminiscent of residential school. One of the examples that people have given is the routine that's involved. So at residential school, there was a very strict timed routine that happened every day, and this is the same way in these care facilities.
Okay, we've talked in the previous discussion about how to create some kind of national strategy around dementia, and what were the 1, 2, and 3 things you do if you're going to do that. If you were going to do the same kind of thing that focused on Indigenous Canadians, start us off. What would that include?
So I think that prevention is a key place that we want to do a lot of work. And I think prevention of dementia in Indigenous communities looks very different.
How so?
I think we have to really be mindful of the cultural elements that are necessary. So when in traditional kinds of health promotion activities that are recommended, like exercising and things like this from Health Canada for the rest of Canada, working out for 20 minutes a day might not be feasible in a First Nations community, and it's not really in line with traditional cultural values as far as I've been told. So that activities of getting people back on the land and maybe having more moderate exercise, but activities that connect people to their culture, spirituality, and memory of the geography of the land and things like that could have greater benefits than 20 minutes on a treadmill.
Right. Karen, what would you add to that list in terms of prevention?
Prevention? Just everyday routine, hunting, fishing.
That helps, eh?
Yeah, picking medicines. You're out on the land, you're remembering, you're sharing with a younger generation. Yeah.
Socialization is so key, I'm told, as well. Yeah, you find that as well?
Mm-hmm.
What do you think is most needed to see improvements in brain health in Indigenous communities? What's the one piece of advice you'd give? Here's how to improve your brain health. Do it.
Just going back to those traditional activities. Yeah, every day doing something that's, your food is from the land or your tea is from the land. You've gone out there and picked it yourself. You've gotten fresh air in doing that, and those kinds of things.
What would you add to the list?
I think that I'd go back to the socialization, or to say it another way, is to not be isolated. And
that's very hard with some remote reserves, not to be isolated. I mean, it's true.
Yeah, well, at least not be isolated from your community and your neighbors. And so I think Karen is really capturing it, that the activities she's describing, what's different culturally is I think these activities, they happen with other community members and with family, and so just by nature of participating in those, it's going to get you out of your house and interacting with other people.
Good. Thanks to both of you for coming into TVO tonight and sharing your views on this. Appreciate it.
Thank you.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.